Very good. Thanks for that. What I do have, I will, of course, then introduce you. And here is what I have prepared. I just want to check with you if this is okay and not misleading. So either I do a long introduction of your bio if we have time. For the other participants that had longer presentations, I just kept it very short. But here I have quite a couple of sentences, so I'll tell you. We still have 5 minutes. Duncan is the right pronunciation, yeah?
Mm-hmm.
Okay, good. Is the Director of TMT Research for Deloitte Canada and is a globally recognized expert on predicting the future of consumer and enterprise technology, media, entertainment, and telecommunications. Then he has been co-author of Deloitte Global Research Annual Predictions Report on Trends in TMT since 2008. For that, he meets with hundreds of top tech media and telecom companies globally each year and incorporates their insights into his work. That's what where I wanted to stop. But I actually also have details on you regularly present
Let's just
conferences and no. Okay.
Let's just stop there.
Okay. Okay, this is good. Yeah, and then I will just introduce very briefly your presentation, explaining that here today we will, with you together, take a deep dive into the prediction implications, the growing market for home medical accessories, new data on pandemic, maybe, it's also quite long. New data on pandemic visit tendencies and the new Deloitte survey of US medical leaders. Is that okay?
That's all correct. Yes,
okay.
Yes.
Okay, nothing is missing.
Nope. Can I go get more coffee now?
Oh, of course.
Okay, so I'm just going to go get more coffee. I show that we have 3 minutes and 20 seconds left. So it will take me about 1 minute. I'm just going to take this off and back in a minute.
No stress. Okay.
I'm just playing with the lighting levels. No, they're not bad. Okay.
Very good.
It's very bright and sunny outside here in Toronto today, so I was just lowering the I don't even know how you say it in French. The the thing,
yeah.
the thing that you lower outside a restaurant to put shade, ombrage.
Yeah, it's called pergola, something.
Pergola, voilà,
yeah.
C'est ça.
No, it looks very good, and we are also hearing the birds. So that's
well, it's actually funny because we're at about the same latitude as Grenoble, and it gets morning at about 6:15, 6:30. So the stupid birds, we have our windows open at night, and of course, all the birds are waking us up at 6:30 in the morning.
I like it. It's nice.
It's nice, yeah. It's better than winter. Okay, I'm good to go. Let me know.
10 minutes. So I'll open and close, and I'll disappear also after having introduced you, yeah?
Yeah, I'm just going to move right now so that I'm going to stop seeing you. And actually, I've got a thing here that I don't need to see. I'm just going to go into presentation mode so that I can see it. It should look perfectly fine for you, correct? I'm just going to make sure it advances and goes back. There we go.
Perfect. Okay, let's go then.
Je suis prêt.
Hello. Hello, everybody. Welcome to our new conference. I'm just waiting, a couple of seconds, letting time to people to join us. So I'm here now with Duncan Stewart from Deloitte that will introduce us to the topic Video Visits Go Viral. COVID-19 sparks growth in the video doctors' visits. Just very quick, a quick reminder or recommendations if you want, and I invite you to share your questions with us for the Q&A session at the end of the conference. Please use the chat for that or the questions button, both without any difference, because we have been experiencing a bit of troubles, but don't be shy and send us your questions. Okay, so it's my pleasure to introduce you to our presenter now, Duncan Stewart. Duncan is the Director of TMT Research for Deloitte Canada, and he's a globally recognized expert on predicting the future of consumer and enterprise technology, media and entertainment, and telecommunications. He has been co-author of Deloitte Global Research's annual predictions report on trends in TMT since 2008. He meets with hundreds of the top tech, media, and telecom companies globally each year and incorporates their insights into his work. So today, together with Duncan Stewart, we will take a deep dive into the prediction implications, the growing market for home medical accessories, new data on pandemic visit tendencies, and a new Deloitte survey on what is the optimal level of virtual visits going forward. So Duncan, many thanks for joining us from Canada this morning for you. And I leave you the floor.
Merci beaucoup, Laure, et bonjour à tous. It is a pleasure to be back in Grenoble, even if only virtually. For the last 10 years, it's been my pleasure to give a presentation every year on the predictions at the Chamber of Commerce in Grenoble, the CCI, and I miss being there. I love your town, and I wish I was there in late May. I know how beautiful the mountains are. So I'm sorry not to be there in person this year. We sort of hoped that would happen, but there turns out that there's this large global pandemic that's preventing that kind of travel. So you can understand why this topic around virtual visits, both during the pandemic and afterwards, is so incredibly important. So let me kind of walk you through our prediction, and I'm going to be giving you not only the research that we did back in December and January, but I've been having conversations around the world with technology companies, telecommunications companies, regulators, doctors, hospitals, all kinds of, in many, many countries, Europe, France included. Happy to talk about all of that, but also Asia Pacific, South Asia, around the world. So it's a big topic. What's the prediction? We predict that the percentage of virtual video visits will rise 50 times. So what it was in 2019 going forward is going to be much, much larger. Now, why does that matter so much? Because around the world, we go to the doctor an absolutely astonishing number of times. There are 8.5 billion doctor visits per year globally. That's just the OECD 36. The number worldwide would be well over 10 billion. And it is a market that is $500 billion. So even a small percentage of $500 billion markets turns out to be very, very large numbers. You can see the stat here. We're looking at about 400 million video visits and about 25 billion in value. So, just enormous numbers for 2021 and beyond compared to pre-pandemic levels. Now, let's pause there. That's big. That's a great number. Are there any other kind of beneficiaries from this elevated level of video visits? And the answer is yes. There are a number of telehealth virtual visit solution companies. In France, you have a company named Doctolib. I'm sure most of you know that. There's another one called Care with a Q. In the US, there's Teladoc and Livongo recently merged. Here in Canada, we have companies like Maple and one called TELUS Health. So one of our telcos has a health business they've had for years now, and it just reported last quarter. They broke out their numbers for their health division, and it is rumored. I mean, I'm not saying this is going to happen. I'm not saying it's not going to happen, but it is rumored that they may take that public on the stock exchange, and it may end up being worth $3 to $5 billion. So there's an entire industry of solutions providers, and some of that is video, and some of that is text, and some of that is prescriptions. But as a bundle, that is a large and growing industry with billions in revenues and tens of billions of dollars, maybe even hundreds of billions of dollars in market capitalization. So from a stock market, from a market valuation perspective, this is a hot and growing area. You know what else is hot and growing? I was at CES in Las Vegas this January, virtually, once again. And one of the biggest areas that we talked about was home health care technology. This was just, everybody was discussing it at CES in Las Vegas. Now, to be clear, I'm not talking about, gadgets and stuff like that, I'm talking about FDA-approved medical-grade devices. Now, why? When I have a video call, as I'm having with you right now, if I was a doctor, I could tell a fair bit by talking to people. You can discuss things, and maybe, I suppose, if you've got a cut or a rash, you can show them, hey, look what I did, But there's all kinds of things that the doctor cannot tell over a video link. These technologies, and I'm just going to give you a sample, are used for measuring blood oxygenation levels. They are used for blood sugar levels, blood glucose monitoring for diabetic patients largely. They can be used for atrial fibrillation diagnosis. That's a complication where the heart beats irregularly. EEG, EKG, the list goes on and on. Now, not only do those technologies, the phrase I use is, those technologies turbocharge video visits. In other words, they make the video visit much more like a visit to an actual hospital, clinic, or doctor's office. But it's also a $33 billion a year industry worldwide, growing at double digits. One of the areas, of course, in the technology space that we get real interested in is the smartwatch space. Apple's watch, as just one example, is already an FDA-approved device for the monitoring of atrial fibrillation. There are rumors that there will be other watches out there, or perhaps the Apple Watch itself, that will be useful in other ways. One of them is talking about through-skin monitoring of blood sugar. Frankly, I'm a little skeptical about that one. That's really hard to do. But it does give you some idea that over the next, 2, 3, 4, 5 years, we're going to see just a avalanche of new home technologies that allow video visits to be much more medically effective. Some of the data points that we have from the pandemic, you probably know some of these, but I'll go through them quickly. US Medicare. Telehealth was 0.1%, and it rose 435 times. This was a giant forced experiment. Can nearly half of American Medicare visits actually be done virtually? And the answer turns out to be yes. I'll show you more about that. Video purely, Veterans Affairs, once again in the States, rose 12 times. In France, this is just a nice point here, Dr. Lieb said in a press release that video consults rose from 1,000 a day to 100,000 a day. My own estimate, Dr. Lieb didn't say this was my own number, but at one point, it looks to me like at the peak of the pandemic, this would be last April, France was seeing on the order of 9% of all daily visits being done over video. So that's once again a nice reminder. Okay, now I promised you a deep dive. Here comes the deep part. This is an academic paper that was published last year. And I like this because it is a peer-reviewed, statistically valid, properly done. And it isn't just a press release from some company. No offense to my friends at Doctolib, but it is a proper academic survey. Okay, so hopefully you can all see my cursor on the screen here. I'm going to walk you through this because it's fairly small font, but also complicated. So I'm going to walk you through this fairly slowly. On the week of March 1st, 2020, prior to the pandemic hitting, you can see the telehealth at this is the Ohio State University Wexner Medical Center. Now, if you've never heard of that, it's kind of like the Mayo Clinic in Rochester, Minnesota, but in Columbus, Ohio. It is one of the top 20, 30, 40, 50 medical centers in the United States. It's actually famous in the States. Everybody would have heard about it. And they are a highly reputable, very well-regarded medical center. Okay, so telehealth back in March 1st, 0.1%, in person, 99.9. Okay, pandemic occurs and something interesting happens. By the end of March, the shift to telehealth is pronounced. 92% of all visits are now done virtually. However, 71-ish% of those, 70.5, were being done over the telephone. And the telephone's fine and it's good. That's great. That's great. But only 21% were being done over video. Okay, that's interesting, maybe a little puzzling. Now, if we fast forward 4 more weeks, something really interesting occurs. The percentage of visits is telehealth is now even slightly higher. The number of visits is up, and we've seen a dramatic shift. And I really want to stress this. What we saw is video visits went from a minority of telehealth to a majority where 7 in 10 of total visits are now being done over a video link. Okay, and I really want to stress that. This is a big debate. When people talk about virtual visits and telehealth, there's always a conversation is this just going to be people calling up doctors on the phone, or will it be this kind of video interaction? Now, the data from around the world is all over the place. In the UK, most telehealth was done over the phone. In the US, a lot was done over video. In Taiwan, a whole bunch in remote areas was done over video. In Belgium, most of the visits were done over the phone, except for psychiatric consultations where more than half were done over video. I think you get the idea. We really don't know for sure yet. But there certainly is an interesting and emerging conversation around virtual visits and telehealth, but video visits specifically, okay? Now, I want to talk a little bit about what happened between March 29th and April 26th. I have a theory, and I'm going to just talk about me at first. So I was actually in Paris on March 16th. I was coming back from a trip, and I was in Paris, and we went home just before all the lockdowns hit. On March 16th, before I came back home to Canada, I was in Turkey before Paris, and I was doing client meetings in person. There was no Zoom calls. I had, true story, I had never done a Zoom call in my life on March 16th. By April 16th, after I'd been home and resumed doing my Deloitte work, I think I'd done 300 or 400 Zoom calls in a month. It was just this most amazing learning curve for video. And it's not just Duncan. When I look at UK data, this is from Ofcom, the regulator in the UK. Ofcom disclosed, and you can look here at the far left, that prior to the pandemic, February 2020, just over 35–40% of UK adults were making video calls at least weekly. That number doubles. More than doubles, actually. We have, like a look at the number for Zoom. It had gone from, what is that? 0 to 20. Just this amazing forced experiment and transition into video. Now, a lot of people at this point go, okay, Duncan, I get it. During the pandemic, I understand why people were very, very interested in taking a look at using video as a medical tool. But once the pandemic's over, we're just going to go back to the doctor's office, right? Well, let's take a look at that. My colleagues at the Deloitte Center for Health Solutions in the United States conducted a survey this year. This is not old data. This is really recent. They conducted a survey in 2021. And what they did is they asked 50 of the leading doctors, hospitals, clinics, thought leaders in the space in the United States a series of questions around what do we do about virtual health, not during the pandemic, but after the pandemic, okay? Now, this slide, I've got to go slowly because a lot of people get confused. What I want you to take a look at here is the first of all, I want you to focus up here, up top, right? Because emergency room cases, if you've got a knife in your chest, you're not going to do a video visit, okay? It's a bad idea. Go to the hospital. On the other hand, when you look up here at primary care and chronic condition management, those are 60 to 70% of all doctors' visits in most countries. I suspect that data is for the US, but I suspect it would be true in the US, in France as well. When I look at those two categories, chronic condition management and primary care, not only are they the bulk of doctor visits in most countries, they display a really interesting pattern from our survey. So what we asked is basically two questions. At the peak of the pandemic, at the very worst of the lockdowns, when people couldn't see you in person, what was the maximum number? What was the percentage of the visits that you did that were virtual at peak? And the answer was about 45 or 41%. So call it just under half, okay? At the worst of the pandemic, about half, a little under, of all medical visits were being done virtually. Fine, no surprise at all. That lines up exactly with a lot of other data I've seen around the world. Where it gets more interesting is that we then asked them another question. We said, what do you think is the best level for video visits? What's the right number? What do you think would be optimal for the entire medical system? And here is a number that completely shocked me, and I wrote this prediction. I thought they would have said 10 or 15%. In fact, they said 30 to 34 for chronic condition management and primary care. Now, I have had a lot of conversations with doctors and hospitals and regulators and so forth around the world. The first point I want to make is nobody's getting rid of physical visits. Nobody is suggesting that virtual can replace physical entirely. That is not what anybody in the world thinks. What they are saying is, let's talk about Duncan. Let's talk about me. Historically, here in Canada, Duncan feels unwell. I don't know what. I actually would call on the phone my doctor's office and I would say, hi, can I come in and see Fred? That's my doctor. And Fred's person would say, sure, come in. He's available tomorrow. And I would come into the doctor's office and I would ride on transit and I would sit in the waiting room and maybe Fred was late and maybe I was late and all that stuff. They don't want to get rid of that. What they want to do is when I call up and say, hey, I'm not feeling well, they say, hey, would you like to start with a virtual visit? Why don't we begin your medical journey with a quick video call? And there are a number of outcomes. One, maybe Fred can solve your problem over video. That's great. Maybe he can't. And he says, hey, Duncan, you actually got to come into the office. Okay, that's okay too. Or he goes, I don't even need to see you. I need to refer you to a specialist. Don't bug me in my office. Why don't you just go straight to the specialist? Finally, he may say, I hope this doesn't happen, Duncan, you're having a heart attack. Please go straight to the hospital. My point is that video visits are a step on the journey. They are a form of screening. They are a form of triage that allows both the doctor and the patient to have an improved experience because nobody needs to go to a doctor's office just for the fun of visiting a doctor's office and reading the magazines in the waiting room. Instead, if we can replace even some of those in-person visits with video, there is a saving to the doctor, there is a saving to the patient, and there is a saving for the overall medical system. Now, on that point, I've been talking for about 18 minutes. I've got another few minutes here that I'm going to just talk about before I go to that slide. So let's drill down on a couple things that people always end up asking me. Duncan, what about old people? That's not the problem. Historically, older people were more afraid of using technology, or maybe they didn't even have the devices and maybe they didn't have Wi-Fi. That is largely not true. 70 to 80 to 90% of those over 65 now have Wi-Fi. 97% of UK residents over the age of 65 have access to a smartphone, tablet, or computer, and they know how to use them. I dislike sharing personal stories as data, but it is such a good example. I want to talk about my mom. My mom is 81 years old this year, and she is terrible with technology. My mom is now the queen of Zoom. The way that she talked to her kids, my sister and I, the way that she talked to her grandchildren has been over video calls. My mom is now an expert on all of this stuff. Okay, so that's she has the tools, she has the knowledge, she has the connection. How did this translate? This is a real world example. My father has Alzheimer's disease, AD, and he progressed during the pandemic. At first, he was home with mom, but then he had to move into long-term care. And what has ended up happening is that my dad is in long-term care and my mother's about 10 or 12 kilometers away. Mom doesn't drive, so it's quite inconvenient for her. She visits dad every day, but it would be inconvenient of her to visit 5 or 6 times a day. What they've been doing is using computers and tablets. They have been having medical consultations between the doctor who is at a hospital, my dad in long-term care, and my mom in her house 12 kilometers away. Nobody is in the same room as each other, but even for 80-year-olds, they are using video solutions as a way of providing medical care to the elderly and to those who are suffering from things like Alzheimer's. That is one story from my family, but I am seeing that pattern around the world. Many, many people over the age of 65 are capable of using video visits. That is not the digital divide you want to worry about. Well, which one is? We want to instead think about frequently the poor. If we are looking at people from lower income, they might not have the right tools. They might not have consistent levels of connectivity. They may not have the digital literacy. You also probably want to think about recent immigrants. This is something that we don't tend to think about, but they've just shown up. They may not have Wi-Fi. They may not have the right tools, and they may not have language proficiency to use a digital health system. If in France, if you haven't got it in, I'm making up a language here, Armenian, if you haven't got your website translated into Armenian, recent people from Armenia wouldn't be able to use it. What would be another example? Oh, we often don't talk about this. Is it ableist? We have various kinds of disability out there. Are they able to use virtual visit technologies? Can somebody who is visually impaired, can somebody who is hearing impaired use the system? And of course, people with diminished mental capacity, are they capable of having a virtual visit and managing all the tools? So are there important divides out there? Absolutely. The final one I want to mention, this is a big deal, is rural and remote. Now, I visit France. I used to visit it many times a year, and I hope to visit it again this summer. I know that if you are in downtown Paris or Grenoble or Lyon or Toulouse, the internet is perfect. I know that. It's really good. It's really reliable. If you want to have a Zoom call, you have a Zoom call. I also have visited a number of smaller towns in France in the summer. I go hiking. I do randonnée. And in some of those small towns, the internet is not so good, especially if the weather's bad and it's been raining or something like that. Frequently, the internet speeds can be slow enough that you wouldn't be able to have a video call. So one of the interesting things about video visits is I think it's going to be a dramatic accelerator of the need for high-speed internet everywhere in France. Now, I am now going to turn it over for Q&A, but before I do, I don't have a newsletter, but I do write about video visits and many other topics on Twitter, on LinkedIn, on Facebook. Please feel free to email me if you'd like to do that, or follow me on Twitter, LinkedIn, or Facebook, where I write articles about all of this stuff. On that note, I am going to pause and see if there's any questions. I need to put my glasses on for that.
Thank you, Duncan. Yeah, I was really always waiting for commenting myself, but we have a certain couples of questions that I will read you maybe before. Why do I need to call a doctor if my bio and health data are already available for artificial intelligence? Cannot IA direct me to the doctor just if I need him or her?
No, I mean, thank you for asking. And whoever asked that, remember I said, follow me on Twitter, LinkedIn, and Facebook. I am about to write an article, I don't know, today, maybe tomorrow, there is a fascinating thing. So everybody in France, I think, has probably heard of the NHS, National Health System in the UK. It's the big system there. The NHS just came out with a 187-page paper explaining why they are not using artificial intelligence for breast cancer screening. Everybody has assumed that AI is very powerful, and it is. It absolutely can see the difference between a dog and a cat. 100%. AI is very good at recognizing this is Duncan and this is Laura. Wonderful. AI is not yet ready, for example, to distinguish between a mammogram of somebody that is of concern and one that isn't. According to the NHS, AI is not yet good enough for wide adoption. There's a lot of talk out there about people saying, oh, let's just use AI. And Laura, to the person who asked that question, 10 years from now, almost certainly. But in 2022, nope. We need doctors. It turns out that there are some problems that AI is really good at. Do you know what they're not good at? Talking to human beings, looking into our eyes, listening to what they say and going, you know what? I think something is wrong. If they can't do it with a static image like a mammogram, they are no substitute for a face-to-face video conversation. Great question, but not yet.
Many thanks. We have 4 minutes left and a lot of questions. Video visits, the increase, are we going to see increased death rate? So in other terms, can doctors miss symptoms and through teleconsultation?
It's a good question. We need to see large RCTs, randomized clinical trials, where doctors treat some people in person only, and some doctors treat people with a mix of video and in person, and then look at the death rates. That study has not been done. However, we do know that through the pandemic, we have had video visits. There are not, so far, a lot of stories of doctors saying, oh no, I missed this and half my patients are dead. So far, that does not appear to be the pattern, but we do need large random clinical trials.
And are they planned, these clinical trials?
I'm sure they are. I haven't heard about them yet. I would do that. You would do that. Every government is going to do that. That'll happen.
Okay, good. Thank you. What about the confidentiality of the video consultations?
Fascinating question. Video visits were actually illegal in many countries because of concerns about privacy and security. During the pandemic, those rules were changed, allowing people and doctors to have video visits. And so far, there have been 0 breaches of patient confidentiality. So far, that does not appear to be a significant barrier.
Good. And personal data, are they stored?
Same thing.
And yeah, the same and used, you know.
A video visit. In a video visit, there is no patient data that sits out there on the Zoom call. The doctor talks with you, talks with me, writes stuff down. That stuff is not in the cloud. It is no more insecure than it was I mean, somebody can always break into your doctor's office and steal the records, right?
Okay. Good. Thank you. Maybe from me, a last question. Can video interactions and Zoom meetings, can they be bad for human health? Like if you don't have so many physical contacts.
I suppose that's possible, Laura. I mean, I'll admit it's possible. But you know what else is dangerous? Getting on, in Grenoble, those trams that go all over the place. You know what's bad for your health? Going to your doctor's office and being run over by a tram. Okay, that's really bad for your health. We know that one. You know what's bad? Sitting on a tram and not COVID, getting a disease from somebody sitting next to you. Going out in the rain or snow and getting cold and you get sick. Are the risks of a video visit higher? No, I can't picture that. I mean, it's an interesting question, but no.
Very good. Many thanks. Good answer. Well, I guess everybody got inspired and excited by your presentation. Many thanks, Duncan. It was fantastic. So thank you. And
merci beaucoup et bonne journée à tous.
Yeah, the same to you. You are starting your day, so enjoy it. And see you next time, maybe in Grenoble.
Okay, thank you very much. Bye-bye.
Bye.